Hi everyone, my name is Monica Howard, and today I'm going to present you with my needs assessment for comprehensive mental health services for elementary and middle school students in Altus, Oklahoma. Now, the purpose of this assessment was to address the lack of comprehensive mental health services for elementary and middle school students in the local community in rural Altus, Oklahoma. Initially, I wanted to address after school activities as well as services for the parents. But after doing some digging and doing more research, I realized that um, this was going to be a bigger undertaking than I actually had time for. So I decided to stick with just the lack of mental health services for elementary and middle school students. So my data collection for this assessment consisted of doing interviews with individuals who worked with 3 different agencies within the community. These individuals all worked directly with the target population, which was the middle school and elementary school students. And the interviews were conducted in person. Each person would ask 12 specific questions about themselves, as well as the agencies and the services that each agency provides to this population. Right, so I interviewed Beth Ferguson. She works for the Department of Human Services in the Child Welfare Division as a child welfare specialist. I interviewed Tanya Boots, who works for Youth Care Oklahoma, and she's a program director there. And I interviewed Gerard Holton, who works for Red Rock Behavioral Health. All of these agencies are present within the community here in Altus, which is small, and I was surprised to learn that there actually are a lot of different services um, out there for this population. Right, so some of the key findings that I had, that I found, services in school, I'm sorry, services, so in-school counseling with referrals. So all 3 agencies offered in-school counseling with referrals. Obviously, consent was needed from the parents, and a referral could have been made from the teacher or the principal of the respective schools for the students. But each agency is actually able to go out and do mental health services in the school setting with the middle school and elementary students, as long as there's consent from the parents. I was also surprised to find that all 3 agencies use the same types of therapy. So there's parent interaction therapy, there's cognitive behavioral therapy, there's play therapy. All 3 agencies actually use the same different modes of therapy. I was also surprised to learn that 2 of the 3 services, so Red Rock and Youth Care, all use telepsychiatry. So neither of those 2 agencies have prescribing providers. So when they have patients or clients who they feel like could use medication, they actually have a psychiatrist who is about an hour and a half away, who can Skype in and meet with the patient and actually prescribe medicine. And if they've already been prescribed medicine, this telepsychiatry can be just to manage the meds instead of them having to wait for the one psychiatrist that we have in town who is usually overwhelmed and not usually taking new clients. All right, and the other key finding was the outpatient services that are offered for both the children and the parents. So as I mentioned before, um, all 3 agencies offer in-school counseling. So that was one of the things while I was doing my research and thinking that a lack of comprehensive services, because I know there are no school social workers here in the local area, but all of these agencies do offer outpatient services to these respective individuals. So if they're unable to go to the school, the parents are actually able to take these children to each local facility, a local agency to get mental health treatment. So some of my recommendations for the agencies, I mean, the community itself is extremely small. But overall, I would say better communication with other local agencies. Like I said, many of the agencies, the three agencies that I interviewed, they actually do offer a lot of the same services. And I know at Red Rock, they're having a hard time with scheduling and getting individuals in. And if they have better communication with the other agencies in the local area, they could refer some of their patients there so they wouldn't have to wait as long to receive treatment. And to go along with this, like I said, the agencies offer a lot of the same services. And if they could get the word out, like I'm on base and I work in the mental health clinic, and I think it would be useful if these agencies came and gave information to local base agencies, so to the school on base, to the youth center, as well as just getting the information out in general to the local community. So what I've learned from doing this assessment, um, I don't know what my future as a social worker holds, but I know I want to work with this population that I did my needs assessment on. That's why I was so interested in this particular aspect of rural social work. And I learned that funding is a big issue for a lot of these agencies. And when you live in a smaller community like Altus, funding is always an issue. They're having to either cut staff or cut programs to afford to continue to keep the overall agency running. So I think it was interesting to learn that, and it's something to obviously take into the future. Like I said, the resources are always scarce in rural communities like this because they don't have um, I guess, the numbers, and they can't continue to pull funding from different things to fund uh, mental health services. So, like I said, my future as a social worker, this is the population I want to work with, and being able to see and interview these three different individuals who work with agencies in completely different capacities was very interesting for me. I just want to say thank you for listening to my needs assessment, and I hope you have a great evening. Thank you.